And welcome back. August is Children's Eye and Health Safety Awareness Month, and in the United States, about 1 in 4 preschool children have an undiagnosed or an untreated vision problem. Now, with students preparing to get back in the classroom, it's a good time to get your child checked out before school starts. And joining us to get more details and share more insight into this is we got Dr. Diana Ilyasova. She is from Pelham Parkway Vision Center. And Dr. Diana, thank you for being with us.
Thank you for having me back.
Good to have you back. And, you know, it is important, as we talked about it, to take a look at children and eye safety. The fact of the matter is we get the whole body checked out, but sometimes we're not doing a good job in terms of neglect, or we do neglect the eyes of our children. So talk to us a little bit about that.
Yes, I'm actually very happy to talk about this subject that I feel so passionate about. Complain of vision problem, and a lot of these visual development and just overall social development and learning development stalls because children have an underlying vision issue, and they won't ever complain because children don't know that other people are seeing better than them. What can they compare it to? So a lot of the vision issues go unnoticed, and it's not like the mom or dad are very ignorant about it. It's just if the child doesn't complain, a lot of this issue goes unnoticed. So I feel very passionate about children's vision because I see what it does to a child once the eyes are corrected, and it's just so heartwarming to see the way they start to progress after that.
Yeah. What are some of the common things that we find when it comes to children's vision that come across your office? Are there any common trends that we see?
Yes. Most commonly, of course, is blurred vision. And probably the next common thing is eye turn in kids. And we do see a lot of tearing. And lately, since COVID, a lot of children's headaches. Many kids are complaining headaches. Part of it is computer strain. Part of it is undiagnosed vision problem.
And so for a parent out there that might be watching, say, listen, my child complains a little bit, but I'm not too worried about it yet. And still, we know that some of the simplest symptoms can lead to major problems. So what are some of the symptoms and warning signs that a parent can look for when looking through the eyes of their child?
Well, the number one symptom is your child is squinting, or your child tends to come closer to the TV, or, you know, hold the device way too close. That's the number one, the telltale sign that there is a vision problem. Children complaining of a headache, that might be the number one reason for a headache here at a children's young age is a vision problem. Eye turn. Let's see. There's a lot of warning signs, but number one is the squinting.
Right. So when we talk about the problems, we know that they're the squinting, the looking up close, and things like that. The question comes: how often should a parent have their child checked for vision?
Well, definitely before school. So around 4 years old, they should check the eyes for any vision problem. But any kind of issues that a child, like a toddler or an infant, might have earlier, he or she should be checked. Absolutely. The child does get gross visual exams by pediatrician as early as 3-4 months, 6 months. So they do get, you know, gross examinations. So the kids' vision checks actually start earlier, but a full comprehensive vision exam should be around 4 years old and up, 3 to 4 and up yearly.
Let me ask the question about astigmatism, because I suffer from one. I know a lot of kids actually suffer from one, but can you define for our audience what astigmatism is?
It's a little bit hard to comprehend, but the outer layer, the outer part of the eye, the cornea, or the lens right behind it, may not be shaped like a full circle. It's shaped like American football, we call it, or an elongated shape. Now, when that happens, the light, when it enters the eye, doesn't all come in at the same spot in the back of the eye. So hence the child gets a large blur circle. I always tell the parent that astigmatism means that in one eye, the vision horizontally does not match to the vision vertically. Okay. And when the light comes in, they're mismatched in the back. And this causes an excessive blur. Also, a lot of headaches, and astigmatic patients have glare sensitivity as well at night, especially.
For parents and people who want more information, talk to us about your center, how they can get connected, and the things that you offer.
So our center is located in the Bronx. Our office name is Pelham Parkway Vision Center. We're located at 731 Leidig Avenue. We offer all children's services gearing for school age kids and up. Now I see kids from 3 and older. I do see all kids emergencies, basically, even if your toddler is having an issue, let's say a cut in the eye or a little sty in the eye or something like that. I do see them at all ages. Absolutely. I do not have an infant clinic set up in our office, not as of yet. But if anybody needs help seeing a specialist for an infant vision, I can gladly refer.
Yeah, I think sometimes parents do have this fear, and I know I thought about it with my child. Like, if my child needs glasses, it's all downhill from here. Can you give us a little bit of guidance as to that parent that may have worries about their child's vision and the possibility of how things can be corrected and really work out?
Yes, that was a fear that my parents had to. My parents had perfect vision, and I had bad vision, and they couldn't comprehend that. And there's always a thought that, like, once you put on glasses, it goes downhill from there. The vision will get worse and worse, which is not true. It's a myth. So the vision does change throughout life, and it can be for everybody, adults and children. But children do tend to progress, with time a little worse. We're in a technology age, so the kids' vision does progress slowly over time. Now, those kids that do progress faster, we have ways that we call myopia control, where we slow down this progression. I always tell parents, vision problem is the worst problem a child should ever have. There's so many worse issues that a child can have. A vision problem is not a big problem. A child is still considered healthy. So that stigma of wearing glasses should be slowly dissipating. It's not a big deal if the child wears glasses. In fact, some kids actually like it to wear as a fashion statement. With time, if the child is not comfortable with wearing glasses, we can, put them in a contact lens. In the future, they can do some LASIK. But it's all, I tell parents that don't fear it, accept it the way it is. Check your eyes, check the child's eyes yearly. And we'll try our best on our end to slow down this progression so the child doesn't get, stuck with a hefty prescription as he or she gets older.
Well, Dr. Diana Ilyasova, thank you so much for sharing with us. Certainly great information. Hopefully parents will take advantage as we're in the summer months, getting their child ready. As of course, August is Children's Eye and Health Safety Month. Thank you for being with us.
Thank you so much. Enjoy the summer, everyone.
All righty. Well, I want to let you know, if you want more information, don't hesitate to visit the website at pelhamparkwayvisioncenter.com. And then also follow them on Instagram and Facebook at Pelham Parkway Vision Center. Now, I don't want you to go anywhere. We do have more show coming up for you. So Open continues right after this.